Thank you for that very kind introduction. Whoops. And I will add my own acknowledgements to our presence here on Indigenous lands and reaffirm my commitment to ongoing reconciliation activities as well in a number of aspects of the work that I do. So, good afternoon. Thank you all for the very kind introduction to join you today. I'm going to be speaking today about some potentially uncomfortable subjects for some people, so I want to give a trigger warning and content warning. Be careful. There are things ahead that deal with intimate partner violence, violence against animals, violence against children, and so please take care of yourselves and others. I offer this support hotline, which is local to our particular region. And very helpful, or if you're a student on campus, please reach out to the wellness mental health supports here on campus as well. And the link is there in the slides. I will be using Menti a couple of times today, so if you have a device with you and you'd like to participate, you can grab that QR code here, and we'll see if I can do this. Good, so we'll test it out. Curious to know who's in the audience today. So if you're willing to share what department, either here at U of G or elsewhere, if you're joining from elsewhere, what's your home-based department? And for those who are less familiar with the acronym, tell me what SOAN stands for. Great, thank you. Perfect. So a nice cross-section, lots of social scientists and medical scientists. So good. I think we'll have something hopefully for everybody today. Whoops. Okay, so I'm going to start off today by telling you a little bit more about the journey that I've been on to be able to stand here and chat with you about this topic. As the very kind introduction mentioned, a lot of my work as a veterinarian since arriving back in Canada in 2009 after having spent a decade in the United States working in academic circles there, has really involved a lot of feeling like I was at a mature professional point in my career as an emergency and critical care specialist for small animal patients. And so I began to get involved in a number of animal welfare activities here in southwestern Ontario, largely with the Guelph Humane Society, and through that organization getting connected to other more national animal welfare issues and organizations. I also currently serve on the board of directors for Humane Canada. I'm going to be talking a little bit more about that organization as we go through our talk today, but it's also been really influential in my evolution. I came on the work around access to care somewhat accidentally. It was not something that I spent a lot of time thinking about. But a colleague invited me to volunteer. I came into the work with a lot of preconceived notions about who I would see, what kinds of issues I would see as a veterinarian, and was, shouldn't have been shocked by the really healthy human-animal bond and healthy animals that I saw in participating in that work. And so that really started a journey for me of getting more involved in ensuring that that transformational experience that I had as a veterinarian and combating my own biases against people who are living with different socioeconomic circumstances than my own and with different power and privilege, how could I support them? How could I encourage our profession to shift gears and shift its scope of thought on these kinds of issues? And so I started taking student veterinarians into communities where we looked after the pets of unhoused and partially and inadequately housed communities. And we started moving into First Nations communities as well. So that work culminated in 2019 with the creation of the Kim and Stu Lang Community Healthcare Partnership Program. It was an $11 million gift that was quite unexpected, but has really allowed OVC to launch this initiative of internalizing a lot of that work, which had been largely done off the corner of my desk as a volunteer, now into a formal curricular stream. So all of our student veterinarians are exposed to issues around equity, power, and privilege, and they're trying to look through a different lens at the work that they do in many aspects of their professional lives. I happened to be at a Humane Canada conference, kind of through a lot of that work in 2018 on the violence link, and I'm going to reference what that is in a little bit. One of the speakers at that conference was Dr. Melinda Merck, who is a renowned forensic veterinarian from the United States, has kind of largely started that as a specialty option for veterinarians. Her talk was very inspiring, and she challenged everyone in the room to be able to look at the issues around animal injury, animal maltreatment, animal cruelty, animal abuse. We're going to come to sort of explain some of those terms as well, but really challenged us all to think about this work through a One Health, One Welfare lens, and that right now, a lot of that work was happening in siloed conversations, that social workers were having a conversation about the things that they looked at and the clients that they interacted with. Police officers and law enforcement professionals were talking about things in their own space. Veterinarians were late to the conversation. Of course, we understand that cruelty against animal or animal maltreatment is something that happens. Most of us live in this happy little bubble where we think, oh, it never happens to me. I'm never going to have to look at that or think about that because all of my clients who bring animals to me are going to take really good care of them and look after them really well. And so it was very eye-opening, and that call to action was very inspiring to me to recognize that, again, in my position as a professor in one of the vet schools in the world, highly ranked, that I had a large body of student veterinarians that had to listen sometimes to the things that I wanted to say. And therefore, I had a position of privilege and power that I could bring some of this information into the path and into the lens of some of the students that I was teaching. And so that really launched sort of the last iteration of my career, which is to have become a forensic veterinarian or someone who has training in veterinary forensic science. I completed an online master's, coursework master's degree through the University of Florida in 2022 while I was on sabbatical. And since then have been looking for ways to try to incorporate many of the things that we're going to talk about today into our curriculum in veterinary medicine so that students are more prepared for some of the things that they may encounter as a practicing veterinarian, and to really challenge them to think about these kinds of issues from a more holistic One Welfare lens as opposed to more of the transactional kind of lens that they're maybe perhaps more traditionally used to using in these kinds of scenarios. So that's really been my journey to this. More recently, I've started a small consulting business and am starting to reach out and make more networking connections to different law enforcement agencies and the legal community to, again, help them to understand how veterinarians can be helpful in addressing some of these serious concerns about the link between animal maltreatment, human maltreatment, and the cycle of domestic or family violence that occurs in so many of our homes, sadly. So to give you some perspective on this, I want to start with a bit of a story. Let's imagine that you are a veterinarian in practice somewhere. If you're a fairly typical veterinarian, you've got a busy day. Your patient here, his name is Frank. You've been seeing Frank since he was a kitten. He's about 3 now, and you don't know much about his family. They've been good clients. They're friendly when they come in, but you've never been terribly curious about trying to understand more about their life. Your interest is Frank and keeping Frank happy and healthy. So Frank's come in today because he came home this morning. So he's developed a bit of an outdoor habit. Normally he had been an indoor cat previously, but over the course of the summer, his family has reported that he started to go outside, and this morning he came back with an injury of some kind, or at least that's what they're telling you. No one is quite sure what happened because he was supposedly outside when this occurred, and you recommend that we take some radiographs, check out his injury. Your medical brain kicks in and you do what we do. We start ticking off like, what could this be? What should I do? What should I treat him with? And your curiosity about anything else related to the family starts to wane pretty quickly, all right? You maybe on your peripheral radar registered that there is a child in the family who's maybe 7 or 8 and who does seem to have a very strong attachment to Frank. Seems very concerned that Frank is not well today, but lots of kids come into your practice with concerns about their pet, so it doesn't necessarily register anything especially important to you. Your day is busy. No red flags have come up for you, and so you treat Frank with some pain medication and send him home because your x-rays basically don't identify any concerning orthopedic injuries for Frank, all right? So all is well, right? In the land of rainbow and sunshine and unicorns, that is true. But in this circumstance, there may have been some things that you missed. And by not coming to this situation with a broader curiosity and an interest in the welfare of the family that you just met, you may not have discovered some really important things that are happening in that home. And as a consequence, we've failed an opportunity to assist that family in helping them to address some pretty serious things that are happening in their home. So, just few options. There we go. Good. I will say as well that one of the other things that you missed in chatting with this family is that the dad didn't come, or the male person who lives in the home didn't come. The female partner had sunglasses and long sleeves on when she came in during a day like today where those wouldn't necessarily be typical. And you failed to ask some questions about why did Frank suddenly become an outdoor cat over the summer, which may have been important to know about in this situation. So with those thoughts in mind, we'll circle back at the end of our conversation today and think a little bit more about what we might have done differently in this circumstance to have a slightly different outcome. But I think this is essentially very importantly representative of the kinds of conversations that are frequently happening within the practice of veterinary medicine. These kinds of cases are coming in and out of our practices without us even being aware of them for these kinds of reasons. And family members are reluctant to tell us about dynamics that are taking place in their home, because there are serious consequences to those kinds of conversations. And as a consequence, we also don't ever have the opportunity to interact with other support systems that might be working collaboratively to help support this family to move forward. So as a consequence, we have veterinarians who are talking in their silo and sort of largely ignoring that these kinds of concerns are happening. We have lots of conversations happening within the social scientist circle and the social work circle and organizations that are working to end intimate partner violence in Canada. They're talking about these things, but they're not talking to veterinarians. And we have law enforcement officials and potentially animal welfare inspector officials who are also talking about these kinds of concerns, but none of them are talking to each other. And as a consequence, we again now fail to have policies or protocols or supports in place that allow a family who finds themselves in a situation like this to be able to seamlessly look out and find some of those supports and get the help that they are looking for. And as a consequence, unfortunately in our country and many countries around the world, the cycle of intimate partner violence, family violence, is having a profound silent effect on the kids, predominantly, who live in those homes. We'll touch on some of the research here in just a second, but exposure to those kinds of things has now ticked the pathway, the future pathway of that child from growing up and not ever having to worry about those things to now increasing the risk that they will develop those kinds of behaviors and choices as they grow up as well, and the cycle will only continue. So it's very important from that perspective for the future to reduce the number of people who are harmed by family violence and the number of animals who are harmed by family violence, for us to be working on an integrated, collaborative process of how we can better address this kind of social harm that's taking place within so many of our communities. So, many of you, hopefully most of you, will be very familiar with the concept of One Health. And again, there's a number of infographics that demonstrate the sort of principles of One Health very well. I like this one in particular because it is got quite a different Venn diagram in the middle than plopping One Health in the middle of human, animal, and environmental health. And what's nice about this, which is what I think this kind of a more modern approach to thinking about One Health, One Welfare, is that it includes a group of people who are having a verb here in the middle, that there's actions that they're taking in order to try to achieve some sort of an outcome, which is what we're, I think, mostly interested in. Critics of the concept of One Health would argue that historically we've been really focused on using these kinds of vague, hard to understand concepts a lot on human health issues, and that we haven't spent as much time focusing on the welfare and health of animals or that of our environment, which is probably the most difficult part to bring into these conversations. And so as a consequence, we've seen emerge some additional kinds of concepts. And one of these has been labeled One Welfare. And this is a sort of more encompassing concept that is very strongly rooted in the principles of equity, collaboration, conversation, and ensuring that we have lots of really difficult conversations to ensure that we're not missing something, that we're prioritizing the maximal benefits for both humans, animals, and our environment, or the environment that they share together. So it's really, again, there's lots of different diagrams to try to represent this one welfare concept, but one welfare, I think, even though it has a different name, is again building on the concepts that we talked about with One Health and really focusing on the action of these kinds of concerns and issues, bringing people together in complex, difficult conversations in order to try to balance resources and balance how we develop policies to ensure that the most number of sectors can benefit from whatever we do to address these kinds of things. So you'll see on this umbrella organization that child abuse and animal cruelty issues are right up at the top and are a really strong focus of this sort of approach to things. As we move into, again, talking a little bit more about an issue that, again, has such strong roots in the One Health and One Welfare communities, and that's a concept that we call the violence link. Again, I've put up two slightly different Venn diagrams here. The one that we, again, traditionally think about here is on your left-hand side, and that is to think about how patterns of family and domestic violence will impact all living creatures within a household or a communal living situation. And that those who are living in that situation, who have less agency, who have less power and privilege to accomplish any change in their situation, are likely going to become victimized by someone who is enacting this cycle of family violence that they were patterned, likely as a child, to reenact as an adult. I'm going to let somebody else deal with that waiting in the lobby. Okay. On the right is maybe a bit more of a futuristic concept of what the violence link could encompass. This is a Venn diagram that's being promoted by Humane Canada, which is, again, a national charity here in Canada, whose focus is really the national voice of humane societies and SPCAs and some rescue groups here in Canada. They're one of the few organizations in Canada who are working at a national level on issues related to animal welfare and have invested heavily in the violence link. They've developed a resource support center for the legal profession called the National Center for the Prosecution of Animal Cruelty, and have developed a number of programs around educating men and boys around how to enact their masculinity so that others don't have to be harmed in their understanding of themselves and what it means to be a man. And also especially around promoting education and collaboration, again, bringing the One Welfare lens to a lot of the conference activity that they do. So there is their National Animal Summit, which brings in some of these elements, but they also put on a conference related to the prosecution of animal abuse and cruelty, as well as the violence link itself. So one's a little bit more specific to the legal profession, but includes everybody, and the other is much more of a collaborative conference that tries to bring all of the stakeholders into the conversation. So their concept, as you can see, goes beyond where animals may be exposed to violence into broader and much more complex issues within our communities. And so we may evolve to thinking about the violence link in this perspective. I'll put in a little plug here as well for Humane Canada. They publish a number of toolkits, this being one of them, that again just help us to retain our focus on the fact that this is such a hidden kind of issue within our communities, and therefore we need to be thinking about it as often as possible. This is from the Veterinarian's Toolkit, and I encourage my students to look this up, to find it, and to put it up in their practices where they go to practice if they understand these concepts and that they're important to them to address in their careers. And it is, if you are being victimized or have family violence taking place in your home, this is a beacon, as many of us in different communities recognize. When I walk into a place of business and see a rainbow flag or a pride flag, I know that I'm going to be welcome there and that there are resources and supports that are available to me. Making this kind of thing visible, again, helps these conversations to happen more readily and more easily within these kinds of scenarios. There's not strong evidence, but among the top 3 professionals that someone who is currently attempting to survive family violence will most likely disclose to is a veterinarian, along with hairdressers and dental hygienists or dental professionals. These are the few places that an abuser will often let their victim attend unsupported, and they're one of the few places, again, that that person has where their activities are not necessarily being monitored at all times. So, as we move into talking a little bit more about the violence link, again, since we're a research body here, I'm going to talk about some research that we have. It's interesting, I think, for those of us who have been working in this sector for a while. This is just intuitive. It makes complete sense that these are issues that we shouldn't even question exist. And yet, this is the scientific world that we live in. We've got to prove things to ourselves. And so the literature is starting to become much more populated with different kinds of studies. I'm going to highlight a few today just to give you a sampling. The literature in this area is much deeper than what I'm going to present today. And interestingly, there have been a number of folks who've questioned whether this is a real thing or not, or have we made it up along the way. And so increasingly there will be others, I think, who try to document the evidence that this exists. So this particular article, I think, is a great one if you're only going to read 1 or 2 things. This one is a very nice one. It's a nice summary from a social scientist writing point of view, who's really, again, I think, taken more of a one welfare, one health lens to looking at this. It's a bit of a review, so it brings in, at least at the time of writing, which was in 2011, the available evidence that existed at that time. And what we know for sure, as I talked about earlier, is that there are these really well-documented epidemiological associations between the presence of animal cruelty, either watching it or committing it, in serial killers, serial and violent homicidal individuals. That was among the first information or first red flags that we had, was the FBI sort of birth of their profiling unit, that when they talked to violent offenders who had multiple serial homicides, that there was this triad of things that they identified in the childhood of those individuals. One was animal cruelty, the second was starting fires, and the third was bedwetting. And of course, our public, when those kinds of things go out into the world, assume that every kid who wet the bed was going to become a serial killer, and that is not how this research works. So it's really important to say that out front. And so I think what we have come to understand is that some of this is explained by a number of psychological theories, that there isn't one theory that applies in all situations, and that there can be multiple things that are taking place at the same time that help us to explain these epidemiological associations. Largely what we're identifying is that these are families that are dysfunctional. There is a pattern and a cycle of abuse that will continue to happen over many generations if we allow it to continue. And therefore, it's important for us to see it from that perspective. So we know that kids who are seeing both intimate partner violence and the possibility of animal cruelty or animal maltreatment in their homes have been set on a different pathway. They're patterned to have their brains start to work in different ways, and that they are potentially more likely in future to, if the environment is right, for them to continue to move in that direction. We know that the maltreatment of pets is a favorite coercive tool for abusers who are trying to control a partner in a violent, intimate partner relationship. And that there are very few laws in Canada or around the world that criminalize that behavior, which is something for us to be thinking about. One of the laws that we almost had across the line until our parliament dissolved and we didn't have it finished yet. So I hope our future parliamentarians will bring that back to vote at some point in the future. What else do I want to say here? Methodologically, again, a lot of the studies that have been published are not strong, well-designed studies. They're often retrospective, they're correlational in nature, and are using sort of non-representative samples. So for example, talking to prisoners who are serial killers probably doesn't generalize to a lot of other situations. Speaking to and understanding the lived experience of survivors of intimate partner violence who've entered into domestic violence shelters don't necessarily speak broadly to all people who are affected by intimate partner violence in perhaps lesser degrees. And therefore, we need to keep those things in mind as we're looking at a lot of this evidence. Great. This study as well, a little bit more recent, published as a scoping review. Again, a number of different social scientists. They have made the conclusion that they see animal abuse as a complex, multidimensional phenomenon. And again, I think that speaks very clearly to what I think I know, and from what I've read about this issue, the kind of understanding of this that resonates the most with me as well. And a lot of this activity is really rooted in a mix of different psychological, social, and cultural factors. That there are some situations where there are psychopathies and different antisocial traits that are uncovered and made more likely to be manifest in certain environments where intimate partner violence or family violence are taking place. And we can definitely, again, in this study, there's a number of papers that they reference that are really making very clear that children are at real risk by being exposed to these kinds of issues in their family upbringing, and that is really where the prevention needs to be focused, and that we all need to be motivated by wanting that to be different in the future. Okay. This is an interesting article again that I like because it brings in some of the ideas around one welfare. And this is the model that they present, and this is this theory that's been developed by someone called the bioecological systems model. And so as you see here, there's a child and their dog Bo that are at the center of this, and that in their closest circle are the school teacher, the family, the neighborhood, the care services that are available in the community, the health services that are available in the community for the animal and the child, and that these have the greatest influence on the child. And yet, you know, what social welfare supports, what's taking place in a political system within that country or that region, all have an important role to play on policies and developing the environment, the ecology of how these kinds of phenomenon can have a more permissive place to take place, or are inhibiting or trying to support and prevent these kinds of outcomes. A really wonderful resource, if you're interested, is the Vega ecological model. So the Vega is a project started at McMaster University that is focused on educating human health practitioners on how to speak to families and how to recognize and understand what your role is in supporting families where intimate partner violence or child maltreatment are taking place. And again, you can see the remnant here of that bioecological systems model, where the individual, their relationships, their community, and the society that they live in all have permissive and or negative influences on outcomes that are of concern for us. I mentioned this article as well. This is a piece of Canadian research, and actually I'm proud to say that Canadians are very much punching above our weight with respect to a lot of the research in this field, and especially the group led by Amy Fitzgerald at the University of Windsor called the Animal and Interpersonal Abuse Research Group, the APARG group at the University of Windsor. More likely than not, if you're reading something about animal cruelty and how it relates to intimate partner violence and child maltreatment, there's probably someone from that group that's involved. So this group has published a lot. This, I feel, is one of the most important articles for us to understand. And it really sheds a light for me, I think, on understanding how these things are linked together. So in this study, they gathered information from 86 women who were survivors of intimate partner violence and had entered services provided by domestic violence shelter across Canada. They asked, using survey, to assess using a number of validated different instruments to ask them a little bit more about the abuse that they suffered, as well as any threats or abuse that pets or animals in the home had experienced. And what we discovered is that they divided their sample into three groups. Folks who did not have an animal in home, folks who had an animal in home and who reported little to no injury to the animal or threat to the animal in the home, and a third group where the survivor was reporting significant threat or harm against animals within the home. And in that study, they documented that in the third group, there was a substantively higher risk that when women in that situation are reporting threats or actual violence against their animals, that those women were at much higher risk of experiencing more frequent and much more severe intimate partner violence. So it helps us to understand that this is a spectrum that exists, and that we definitely see these sorts of associations that take place. And lastly, this piece of evidence that was published using, in the United States, there is a national reporting system through the FBI called the NIBRS, the National Incident-Based Reporting System, that's accessible to all researchers, and all kinds of crimes are categorized and reported into this database from all different police services across the United States. So it's a really useful database. None of that happens in Canada. We don't have a national reporting system that reports on the levels of animal cruelty in Canada. So when we look at the United States, this particular study looked at 278 animal cruelty incidents that had been reported in that database in 1 year. I believe it was 2020. And they, again, documented that intimate partner violence or family violence, when it occurs very commonly with family violence or domestic violence. And they reported very interestingly that these kinds of incidences do seem to be coming to the attention of law enforcement professionals, and that investigations, prosecutions, and arrests are much more commonly happening in these kinds of situations. So it's another lens that we can look at this through, is that these are not people that have been presented to a domestic violence shelter. These are not people that are in jail for serial killing. These are average people who haven't yet or may never have encountered those other outcomes that we're gathering data from to try to understand this issue. And so, trying to wrap up here quickly, save some time for questions. I think how I want to finish this up is, again, to really challenge everyone. Again, you are the future from my perspective. How you think about things, the training that you are receiving in your programs, especially around One Health, and to be thinking outside of the box and thinking about these things from a systems-based perspective. You are the future. Right now, in our traditional approaches to so many of these things, we're not providing education. What I'd like to see is that we're providing proper education to so many different groups. How are we, again, trying to break down these silos so that these separate agencies that are all tasked with some part of this are now coming together and working on these really difficult issues together as a group of agencies? That we're moving from reactive interventions to thinking about that we much more need to have a preventative and a relational focus to the work that we're involved with. Again, to break this silo of that we're only thinking about the most important species on the planet, the humans. No, animals are important too, and the environment that we share together is equally important, and an equally important influence on how these things are manifesting in our homes. And therefore, we need to be moving to this lens where we have a view of multi-species empathy on the work that we are doing. We need to stop thinking about putting Band-Aids and short-term fixes on these kinds of things and think much more about long-term systemic solutions and policy changes that will allow people to move out and to heal and to prevent these kinds of things from happening for future generations. So this is a slide that was again meant to think about the policy implications of these kinds of things, to again think about how we shift our mindset here. Again, fundamentally, right, we think of the abuser as the big bad wolf in these situations. They're the one that should be punished. In many respects, they're also a victim. And we need to include our empathetic viewpoint to thinking about what they've experienced and how they didn't have the opportunity to heal or to move into a different pathway. Again, thinking about how are all of the ways from a public policy perspective that we can support family violence survivors and to be working in ways that get them out of these situations or provide appropriate therapeutic resources for them in those situations to try to turn this into a different outcome. A point that I wanted to mention that I haven't yet is that so much of what we know about this is from an urban environment and urban dwelling individuals. And we know that this occurs in rural, remote, and indigenous communities as well, and that those situations are even more challenging. The opportunity to provide resources and support in those situations, escape from those situations is much more complicated because of the resources and the deep ties that those families have to the land and to the work that they're doing. So it behooves us to not ignore that those are very important things that we must address going forward. Okay, I'm going to skip this from a time perspective. And again, wrapping up, I want to say that, whoops, go back, there we go. Violence does not respect silos. One Health provides the platform for us to be doing work on these issues. One Welfare expands our understanding of One Health and provides us with additional insights and opportunities to address these kinds of things. And that compassion, collaboration, and culture are central to prevention of these things going forward, so that we have a different future in mind for our friend Frank, where his injury, which was actually intentionally caused by someone in the home, is identified as such, and veterinarians have the skills and ability to provide resources, that they are working collaboratively in a system of individuals and professionals who are all focused on ensuring that that family is got the resources they need to do life differently, hopefully stay together as a family, but for sure ensure that their future does not involve a repetition of this cycle of violence. I will stop there.